Hello, welcome to Here for Health. We're so happy that you could join us. We're talking today with Dr. Jeanne Green from back east, who is a hyperbaric oxygen therapy specialist. Dr. Green is a chiropractor, and I'll let her explain to you in her own words her experience as an expert in HBOT, which it is now called, therapy. This is Dr. Green. Thank you, Dr. Green, for joining us today. We really appreciate your expertise and your help in helping to explain what is hyperbaric oxygen therapy.
Yes, so hyperbaric oxygen therapy, in a very brief explanation or definition, is oxygen under pressure. We have a patient go into a chamber and they're breathing increased oxygen concentration either through a concentrator or through tanks, and increasing that oxygen concentration and increasing pressure, we're able to increase the concentration of the oxygen in the blood plasma. We take advantage of a gas law, which is Henry's law, that states that anytime you have a gas that is placed next to a liquid, if you can increase the pressure of that gas, we can diffuse those gas molecules into the blood plasma or whatever liquid you're, much like a soda. That's how they create sodas, as soda pops. They increase the atmospheric pressure, and they're able to push the gas into the liquid.
Mm-hmm.
You take the top off of it, and you can see this gas come up when the actual atmosphere sort of goes back to the normal.
Yeah, when the bottle's open, yeah.
That's right. That's right. And it's the same thing with hyperbaric oxygen therapy.
Well, that's a very interesting point, because I think people who have ever been in a hospital have had a monitor on their finger which measures the oxygen, sometimes 90% or more, we hope, even at high altitude, like we here in New Mexico are approximately a mile above ground. And
that's right.
above atmospheric pressure, sea level. So we still aim for in the 90s, but of a pulse oximeter, which is what it's called. But I understand from what you're saying, the pulse oximeter may not measure the oxygen other than in the color of change of the hemoglobin when it binds to oxygen. It doesn't measure the plasma, but we are increasing the plasma, from what I understand you say, with increasing the pressure surrounding the oxygen that the patient or the client is receiving in the chamber.
That's correct.
Okay.
And I'm in South Carolina. So
you're sea level.
So I'm doing compared to you, relatively speaking, I'm doing hyperbaric oxygen therapy because I'm at a higher pressure altitude.
Relatively, absolutely. There's more oxygen dissolved in that. That's right. Interesting. Well, I guess one of the questions I have is, it seems like the advantages of the therapy are to increase the oxygen content of the tissue that is being perfused by the blood, right?
Yes.
And that does promote healing, which is why I know it's been used in wound healing. But I'm curious as to, are there other advantages of hyperbaric oxygen therapy?
Well, I mean, the biggest advantage is to be able to increase the oxygen concentration to the blood. But I actually saw a very good video Dr. Saunders talks about where even if you have a patient who is in an oxygen chamber, and without the increased oxygen concentration, if they're just breathing room air, 21% oxygen as opposed to 85 to 95% oxygen, they still see changes in stem cell production. I don't know if you know anything about these new studies that are coming out, but they're thinking that maybe even the increase in nitrogen, because it's 78% nitrogen in the air we're breathing right now.
Right.
So they're thinking that just the pressure and the pressure pushing nitrogen into the body has an effect on increasing the function of the mitochondria. There's a lot to be studied about that, but they're starting to see that they're starting to get an increase in stem cell production due to that increase in nitrogen.
From what you're right. Of course, I had also understood that stem cell motility increases, which is how the stem cell basically is seen as having a higher metabolic production.
And I guess that's what I guess it comes down to the health of the stem cell.
Yeah.
Because you can probably compare, say, an 18-year-old or a 7-year-old or whatever to a person.
Or a 70-year-old.
Or 70. You look at different ages and you're going to get different qualities of stem cell, I would think.
Sure, sure.
So, I mean, I don't know enough about, I sort of extrapolate a lot of information, the things that make sense to me.
Sure.
And I feel like you're going to get a better, higher quality. So think about it. If you're getting an increase in oxygen concentration going to the bone marrow, then the production, because the mitochondria are going to produce a better quality cell through the increased ATP production, you're going to get a better quality stem cell.
Yes, yes. I would
I
think
don't
so.
know
More
where that's
capable.
written.
Well,
Yeah.
the problem with so many of these things is that you have to look at the right variable. You have to look at what are you looking at in the research. And I am happy to say that the research I've looked at with HBOT is very, it's been peer reviewed, it's been looked at, and I'm very impressed that, and I've got to tell you, the most impressive thing to me is the extension of telomeres. That is like,
Yeah.
that's mind-blowing. I don't know
Yeah.
any therapy that actually increases the length of, I may just be ignorant, but I'd love to find out if there is one, because
Well,
that's age.
I've not heard of anything like that. And that is like that's the most profound change, which most patients are not concerned. They're not going to be really even know what telomere length that they want longer telomeres, right?
We
They just
all
want to
do.
feel better. They want to get better,
Yeah.
numbers with their labs and all
Right.
of this. So it's not something that's on everybody's radar. But I'm like you. I don't know of anything that
Yeah.
does
But I think the
does
whole
it not? Yeah.
the whole anti or reverse aging, whatever you want to call, whatever nomenclature you use, then we know that the length of telomere on a gene has a direct relationship to youth. I mean,
Yes.
to lack of senescence, if you will. So
Right.
when those telomeres are gone, that's the end, for all of us.
Yeah.
So
Yeah, and
it
so
says a
what we can
lot.
do, at least the very least that we can do is maintain the length of the telomeres.
Right.
And
Now,
I'm sure that a lot of that goes into, there's other variables that go into, that the maintenance of that telomere, the lengthening of that telomere, such as, other good health habits and ways that we can maintain our health.
yeah.
But I definitely think that hyperbaric could be a big game changer for
Absolutely.
a healthy individual.
Yes, I tend to agree from what I've read. I don't think that's an individual opinion on anyone's part. I think it's been
Right.
researched and validated. What are the sorts of things that you get questions about will HBOT work for me? Would it help me? What's the most important part of your criteria for treating someone?
Well, safety first, of course. We
Of
want to
course.
make sure there's no contraindications for hyperbaric oxygen therapy. And, fortunately, there are very, very few contraindications to hyperbaric oxygen therapy. A pneumothorax is the only real absolute
Contraindication.
contraindication, but we don't use hyperbaric oxygen therapy for anybody who has a severe seizure disorder or pregnancy. We try to stay away from that. And so we look at the safety and the health of the patient and make sure that it's going to be safe. And, we just want to make sure that it looks, I like to, see if a patient is going to actually respond to hyperbaric. And so what's funny is there's so many conditions that hyperbaric helps.
Yes.
Somebody comes in and they say, well, I've got a child with autism. And
Like your daughter,
of course, we have a very good history. We have documented, studies that shows that we get good results for autism and Lyme disease and all these different kinds of conditions. So I guess the people, when they come in, they want to know about their specific condition.
Of course.
Is this going to help
Sure.
my condition, my
Sure.
child's condition?
My diabetes, my hypertension, whatever the case may be.
Yes, exactly. And so that's your interface. It's not necessarily like you're not going to talk about, the science of hyperbaric.
Oh,
They want to know if this is going to help.
Yeah.
And so, that's kind of the first step to it is understanding what kinds of conditions are going to respond to hyperbaric.
So you find your first visit, for example, with a potential client, a great deal of explanation and be able to set reasonable expectations based on their goal, whatever they want out of therapy?
That's correct. Usually we don't get many patients who are concerned about peak performance or, general health and wellness kind of thing.
Right.
Most of our patients have conditions.
Okay.
And so, in many cases, what we do is we tell them, we have this thing called the discovery session, and we'll just have patients come in for a very low price and say, hey, we would just want you to experience hyperbaric and see if this makes sense to you. See if this feels like and looks like something that you will do. And, because a lot of this, I mean, it's very foreign to people.
Sure.
And so we want people to understand what they're going to be going through and what's going to be expected of them. And what's crazy is one session is enough, 9 times out of 10, for people to say, hey, this really made me feel whatever positive thing. Like they may feel calmer, they may feel more energetic, they may sleep better at night, that night for that first session. So it really is not one of those approaches that takes repeated exposures to see at least a little bit of a change.
Sure, sure.
Yeah.
So you're saying, I'm getting the impression that if indeed they have a positive experience, or even if they don't have an effect, an improved perception of health, however they define that, it's worth continuing for a number of sessions. Am I hearing you say that?
Yes, yes. And usually what we do, my recommendation usually for patients with condition is this. I mean, we talk about, I think earlier we were talking a little bit about protocols. So let's talk a little bit about what we look, we talk about protocols.
Okay.
And I don't want to drive my practice through protocols, but there are specific conditions that you're going to have that say, it's going to take a while for you to start seeing the needle change in a way that patients are going to get a quality of life change for something like Lyme disease, for example.
Yeah.
Okay. That's something that these organisms, they have dug so deeply into the tissue that it's going to take time to really get to them through hyperbaric. So I might, in my mind, say, hey, this might be 60 sessions.
Yeah.
60 hours of hyperbaric oxygen therapy. But what I'll do is I'll say, why don't we start with 20?
Yeah.
Start getting that needle to move, and then we'll reevaluate
Sure.
to see if it makes sense for us to move forward.
Right. Right.
And I work along with the person's medical doctor along with that, and just try to work it out, because hyperbaric, for example, it does have a very good history for helping patients with Lyme disease. So that's just an example of what I might use, a condition that I would say that's as far into a protocol as I'm going to get.
I see. Well, and that's a reasonable response, I think, because even in ivory tower medicine, we don't necessarily know that what we're going to intervene with, I'm speaking as an MD in this particular case, is going to produce the proper result.
And I don't think that hyperbaric is unique in an application insofar as to say every single person on earth will respond to hyperbaric oxygen therapy. You're going to have a bell curve with any kind of intervention, as you know.
Yes.
Right?
That's right.
So
that's why they call it a law of probability, right?
That's
a law.
That's right. I mean, I know that there's no intervention out there that's going to be 100% all the time on every patient, right? So, but we've got a pretty good history of getting a lot of good results for a lot of patients who have conditions, and it's a low risk. And it's not a whole lot of side effects.
It's a good alternative. It doesn't cause damage, and it does help. So so I mean, sounds like a no-brainer in a way, really. But I wonder, is there a difference between high pressure and low pressure HBOT?
Yes, there is. We here at my clinic, we have low pressure hyperbaric. And low pressure is considered anything, say, around 1.3 atmospheres of pressure to, say, 1.5. When you get up to 2 atmospheres of pressure, you're talking about more like a higher pressure hyperbaric. And so that's more, say, of a hospital setting or burn wounds, crush wounds, life and limb, more life and limb sort of applications. And whereas we might work with more neurological
and circulatory.
Now, I will, yeah, in circulatory, but I will say this, I have had patients who have had wound, we do a lot of wound care here. And it's because it's just so non-accessible for patients to go to a higher pressure chamber, and it's so expensive
Sure,
to go say, to a hospital setting
sure.
for non-healing wounds, which is actually one of the 14 FDA approved diagnoses, but it's not an easy thing to
Yeah,
do to
yeah,
get into a high pressure chamber, you
yeah,
know.
really.
We work with patients who really they needed a high pressure chamber, but they couldn't get one, and we were able to, really get them a whole lot better. But
Right.
it would be like 4 hours a day in a low pressure
Gotcha,
chamber.
gotcha. Well, the other concern I have is I understand that there's higher toxicities like oxygen toxicity risk with a high
Yeah.
pressure. So if you, is there an equivalent, and I wonder if there's an equivalent of benefits where risk versus benefit yield, are you better off for some therapies and for some therapies in some diagnostic states in the low pressure rather than a high pressure? Given that you,
Well, what is said is what really shows that helps neurological conditions is lower pressure.
right, right,
So you don't want 2.5 atmospheres with a condition stroke, right? TIA,
right, right.
those kinds of things. Or a close head injury. You're going to want to stay with a lower pressure. But if you have like life and limb, like if you got the bends and you got a nitrogen bubble, you need
Well,
to get a high pressure.
then, yeah, yeah, right, the indication changes. So,
Yeah, the
so that's
indication
why you
changes
have to
because
do that discussion at the beginning of therapy and say, hey, what do you want to get out of it? What are you looking for? And these are what I can say you might be looking at, although it will always be evaluated at periodic intervals to make sure we're on the right track.
that's right.
Right? Does that make
That's right.
sense?
Well, that does make sense. I have uh, I can't remember her name. She's the president of the International Hyperbaric Association, and she does her daughter had the mitochondrial disorder. Shannon Kennett. I don't know if you know
I'm
who
not
she
familiar
is.
with it. Yeah.
Okay, so Shannon, she started this whole International Hyperbaric Association
Wow.
back when her daughter um, she was an infant, and she had this condition, and her doctors told her that she's going to die. She's got just a few months to live, and Shannon was unwilling to take that, and so she got her to a hyperbaric oxygen practitioner, and her daughter, I think, is like 24 years old now, but and she attributes it to hyperbaric oxygen therapy. But I
When did
say all
she,
that
when did she get the therapy? You say she's 24 years old now. How many years
she
ago?
got the therapy when she was an infant. She's been in a
Oh
chamber for
my.
many, many. I mean, just all her life she's been under hyperbaric oxygen therapy.
Wow. How's
She,
her
you should.
health now? May I ask?
She's healthy. She's a healthy girl, but anyway, and I'm sure she has some neurological conditions, but she's
Residual.
not even supposed to be here. So,
That's a
but
hard
I
point to
say
argue. That's a win.
that she said whenever she was going through this in many cases, and now even she had to stay at a lower pressure than even 1.3, because if
Wow.
she would put her daughter in this higher pressure at 1.3 atmospheres, she would have some neurological side effects of the pressure or oxygen or both. I don't know exactly what it was, but
Hmm.
she couldn't tolerate even 1.3 atmospheres of pressure. So I think it was like 1.1, 1.2 that was where she would benefit from, because it was just such a fragile
Interesting.
and sensitive condition.
And that was when she was an infant, correct?
Yes. Yeah.
Interesting.
Yeah.
Wow. Sounds like it's an up and coming and I think increasingly desirable kind of therapy for a number of things.
Yes.
Are there, for example, I'm sure you're asked this, and I think we kind of covered this, is HBOT or hyperbaric oxygen therapy, is it a wise idea for, like, I've heard of sleeping inside of a chamber for like somewhere between 5 and 11 hours. In some cases with oxygen, in some cases on ambient air. Is this something that's recommended or just bad idea? It's what I see circulating around.
Yeah, I've seen some of that online, but it's contraindicated. So I could never ever tell somebody to do that, to sleep in a chamber for 5 to 7 hours.
Right.
And it may be because they don't know enough about it,
Yeah.
but it's breaking the rules of hyperbaric.
Right.
In hyperbaric, we talk about scuba diving, it's in the world of scuba. And so we stay within the rules. And so
Sure.
that's the way I look at it. It's like it's not something that you do
I
because
got you.
it's not
Well,
indicated.
you know, you're always playing with everything, as you had pointed out so correctly. Everything has, it's a yin yang thing, if you will. It's a merging of benefits versus risk, and that has always got to be on the side of benefit and minimizing the side of risk. So
Yeah.
if you're not going to get an obvious benefit out of something, don't do it. You know, it just doesn't make sense.
Let me say this though. I will say this. When you talk about increasing, and this goes to telomere length too, increasing the time in the chamber, you would be better off by increasing your sessions. Say, for example, if you wanted to do five hours, you're better off doing 5 hours during 5 days of the week, because each time you go in and then you come out, you increase pressure and then you decrease pressure. So we're pulsing, right? We're pulsing that oxygen exposure, pressure exposure, increasing and decreasing. And this pulse actually creates. They're finding out now that these air brakes are actually one thing that helps the telomere length increase. So that's the way that what you can do is get more out of hyperbaric. If you want to get more out of it, staying in the chamber is only going to do so much for long periods of time.
Sure.
Go in the chamber, do 20 minutes with the mask on, take the mask off for 5 minutes, and then put the mask on, because what you're doing is you're creating a relative hypoxia while you're in the chamber. And what it does is it's sort of a oxygen fast for the cell. So what you'll see is that what they're finding is that's how you can really encourage the telomere length growth.
I see. That's.
Have you heard that before?
I've heard of the cumulative effect of stepwise, and I can't help but equate that, or at least compare it favorably, with when we talk about titrating and tapering medications. You don't just stop abruptly with some medications. You don't just start necessarily with the dose you're going to end up with. It's a gradual, because the body adaptation is going to govern your next response, just like you were talking about. How you need to evaluate after these pauses and make sure we're all on the right track, that we don't need to initiate something else or try something different.
But you're not going to take your whole bottle of antibiotics that first day.
Exactly.
You're going to space it out.
Because you rely on that response. For example, in the case of antibiotics, obviously, you're going to kill off the most vulnerable cells, the bacteria, if you will, that's going to respond. But the really resistant ones are going to stay there. Well, you don't want those resistant ones to start multiplying and create a whole new
generation.
Right. So that you have to pulse yourself, you have to take it at certain times so that you're hitting them at each point along their reproductive cycle, so that you can end up with a minimal amount for the relative risk of the antibiotics.
Yeah, I think if and maybe that's the whole thing about it. It's like, you can do it if you have a chamber. If you want to do hyperbaric, do it the smart way. Do it you're going to spend that's a big investment, 5 hours at a time in the chamber.
And why not do it the way that you're going to get the best bang for the buck?
That's right. That's
so
exactly right.
that makes all the sense in the world.
Yes.
So if we're talking about duration of therapy, some of the things that I have to ask you about is what exactly do they mean when they say high oxidative stress at a higher level of ATA or atmospheric pressure?
There's a specific ratio that you have to have with the buildup of oxidation in your body, because from what I understand, it changes the pH. Is that?
I'm sure it does. It becomes more acid, which actually, there's a whole cascade, right? I mean, the body's response is key to any inflammation process. So we talk about decreasing inflammation, but inflammation and stress is part of a healing process. It doesn't have to overwhelm the healing process, because in chronic disease, that's what we're actually trying to circumnavigate. We want to have just enough stress to be able to get the body to, kicked into that fighting stance. Stem cells, white blood cells, natural killer cells. You want to increase that production and defensive response from the body in order to yield the benefits. Like you say, we're always, in the healthcare field, I think we're always playing what are the advantages, disadvantages, and what's your best bang for the buck with the least amount of side effects and obviously safety, right?
Yes,
So,
exactly. Yes, exactly.
okay.
And you don't want to get, if a little bit's good, more's better. That's the philosophy that a lot of people
Yeah.
go by. You don't want all this oxygen. We have, if you have too much oxygen in your
Sure.
body, you're going to create that,
Well, yeah.
that imbalance in
Considering
oxidation.
considering the waste products of metabolism actually increase the blood flow because the cells are in stress, so to speak, with hypoxia. And so they're asking in that conversation that takes place in our body all the time, they're asking for blood to be able to deliver, to be able to wash away the byproducts and bring in new food products like oxygen.
Yeah.
So, so it makes sense to
If it's
me.
coming too fast, they don't have, it's not set up for the mechanism to detox that fast.
Yeah, that's right.
So, yeah.
That's right. We do put our bodies through a great deal of,
Yes, we
of
do.
issues, don't we?
But I can tell you this, what I love about hyperbaric, low pressure hyperbaric is that's not something that we have to worry about that
Yeah.
much because it is mild hyperbaric is so safe.
Much fun talking about this that I want to make sure that before we go, I'm going to ask
Yeah.
you for 2 points that you want to make to our audience that you would like them to take from your perspective of expert. How would you suggest 2 tips for our audience to be able to incorporate better health into their lives?
Well, I feel like probably try to have a good diet, of course, and try to keep as much toxins out of your body. And if you have an opportunity to do hyperbaric oxygen therapy and go through the process of exposing yourself to an increased oxygen concentration for a repeated session, some sessions, and just experience it, because I feel like this is gonna, what I would like to see in my lifetime is to see everybody have a hyperbaric chamber in their home and it become part of the mainstream of everybody's life, because I feel like it's that important to heal.
Yes, I see what you're saying. Okay, I would certainly appreciate your time, Dr. Green. Thank you so much for taking your time and your knowledge and letting us tap into it. Thank you so much. And for our
Well,
listeners, we would like very much to thank Dr. Green, of course, but I also wanted to double check with you to make sure that these are projects and these are episodes that are designed to help you live your life, and we'll give information on how to access research that, as Dr. Green had pointed out, on our website. And if you refer to the captions at the bottom of our website, we'll be able to direct you to further research because there's new stuff coming out all the time. Thank you very much, Dr. Green. Appreciate it. Goodbye from Here for Health. Hello. This is Dr. Lewis from Here for Health, and I'm going to talk about some of the indications that Medicare will reimburse for the cost of hyperbaric oxygen therapy. As a point of reference, in the United States, only 14 diagnoses are acceptable under those particular guidelines of Medicare. In other countries, up to 40 or more diagnoses are used for the hyperbaric therapy, but it's not covered in this country other than through Medicare for those specific indications. And some of those specific indications are non-healing wound ulcers, let me see, I just had a list here. Non-healing wound ulcers, stroke is not necessarily covered, but when you want increased perfusion to an area such as an ischemic area that has not received an adequate amount of oxygen to heal. So in general, the use of hyperbaric oxygen therapy is to increase oxygen supply so that the body can take over the healing mechanism. And that is why it takes a while, on some cases, depending on how long you have had that injury, for the oxygen supply to be reestablished to those tissues. For example, central vein occlusion of the retina. Certainly, as we're aware, for the issues of deep diving at pressures, for example, more than 13 or 17 feet below sea level, which is roughly the 17 feet is equivalent to 1.3 atmospheres, which is a low pressure hyperbaric oxygen pressure. If you actually go deep diving and ascend too rapidly, oxygen diffuses from the tissues into the blood in bubbles, and that's where high pressure oxygen therapy is used on an emergency situation to lower those potentially occlusive effects of oxygen in the blood. One of the concerns with all tissues is that oxygen is necessary for the healing of anything. If there's poor venous or poor arterial circulation to an area, then not much blood is getting through, and additionally, not much oxygen, therefore, is getting through. It's true that hyperbaric oxygen therapy does increase the blood supply, but it takes quite a few therapy treatments before you actually see these effects, sometimes 20 or more. And it depends on what's a realistic expectation for the diagnosis or the condition that you have for the hyperbaric oxygen therapy practitioner to be able to tell you what is the best recommended treatment. But nothing is written in stone. It's a standard deviation curve. You don't know where you are in that standard deviation curve, but if you start getting results, it's something to consider. Just wanted to give you a little bit of background on that. It is not covered other than through Medicare on those 14 diagnoses and no others. Thank you. Have a great day.